Welcome to the Medical Minute podcast. I'm Anne Connell, a Melbourne-based GP.
And I'm Moz Calafella, also a Melbourne-based GP. Welcome to the second episode of the year. Dr. Anne, what are we talking about today?
Today we're going to talk about bone health. So all of us around about the age of 50 should really be starting to think about our bone health. And the reason for that is minimal trauma fractures. But before we go any further, I will remind everyone that, as usual, a podcast cannot replace an individual consultation with your own healthcare professional. Dr. Moz, minimal trauma fracture. Tell us about those.
It is exactly what it sounds like. It is having a fracture from a version of force that we think is probably not reasonable to generate a fracture. And so classically, the definition is, a fall from standing height or less, or, that you've touched something slightly hard and ended up with a fracture. And so most often we'll see these on sort of the hip, the spine, the wrist, the ankle, common places that, not uncommon places to get a fracture with very little trauma. So they're increasing. They're a common cause of harm as we get older, aren't they, Dr. Anne?
They are. Again, the stats would be that from the age of 60, the lifetime risk for a woman is 44%, and the lifetime risk for a man is 25%. So really very common. And the problem is that usually your quality of life is really impacted dreadfully by having one of these. That is, for a hip fracture, 20% of women die within the first year. And in fact, nearly 30% of men die within the first year as well. And half of those deaths occur in hospital while you're still recovering from the actual fall and fracture. And for those who don't die, whether it's hip fracture or something else, your quality of life rarely has recovered within 18 months after the fracture. So we really don't want to be having them.
We don't. And I guess thinking about it early is a really good way to try and mitigate your risk, because it's really hard to change habits once you're a little bit older and or once you've already had your minimal trauma fracture. So we really do want to try and manage it from early on, don't we?
Yeah, we do. So this podcast is probably primarily aimed at people from the age of 50 and up, but we reach our peak bone mass right at about the age of 25 or 30. So we're set up from our starting point from which we decline in our 50s and on. We set that up much earlier in life. So there's definitely something in the podcast for younger people. And even if they think that they're Teflon, they can share it with their mum and dad, And my mum and dad will be in the target group if you're not yourself.
Yeah, so I'm in my 30s, and I often actually think about kind of bone health and how to try and improve that, because I think you see the impact that it has on the older generation. Like you said, you hit that peak quite early on in the piece. And I think even though we're targeting at 50s, people in their 30s and 40s should be paying attention and thinking about how to sort of implement some of these changes so that they don't have to make wholesale changes in their 50s and 60s.
Yep. Absolutely, very happy. So what a surprise. The health podcast is going to talk to you about diet, about exercise, and about lifestyle. Who would have thunk it, Dr. Moz? These
Indeed.
Are things that are going to impact our bone health.
Don't switch off the podcast just yet. We're not done. There are some specifics around diet, lifestyle, and exercise. So let's get into
some in the detail, as always, for all of these things.
But bone health, I've got to eat well, got to move more. Got it? Great. Switch off. Next podcast.
No.
There's some details.
There's some details. Okay.
So calcium.
Calcium, we will start with calcium. Calcium is an essential element for the body, and we can't make it, so we have to get it from our diet. There's no other way of us getting it. Bones are, I think, about a third by weight calcium, and about 99% of our body's calcium stores are in the bone. And the reason that is really important is that the body will maintain your blood level of calcium however much you do or don't get in your diet. So if you don't get enough calcium in your diet, your body will just remove it from the bone to do the other things that it does, because it does do other things other than make the bone hard and strong. What else does it do, Moz?
Yeah, of course, we need calcium for lots of other things. So we need it for transmission of nerve impulses, sending signals around the body to do particular tasks. We need it to ensure that our blood clots appropriately. We need it for some hormones require it to sort of be transmitted and send the signal across. And of course, we need it for muscle health as well. So lots of jobs for calcium in and around the body. Extremely important, mineral to be found in the body.
Absolutely. And sometimes people will say to me, can we just check my blood calcium and see
Mm.
whether I need to take calcium supplements? And I understand that that seems very logical, but because calcium is so important to the body will keep your calcium level normal, whether you're getting enough or not. So it doesn't tell us whether you're getting enough at all.
So it sort of robs Peter to pay Paul. So
Mm.
if you don't actually have enough calcium, your blood calcium will remain normal. Because as you said, Dr. Ann, you just steal it from the bones to sort of look after all the functions that you need in the body. So we'll never know about whether your bone calcium storage is adequate or not.
Yeah. So getting older sucks at lots of levels, and one of the things that's quite sucky about getting older is that you become less efficient at absorbing calcium from your gut. So the end result of that is that the recommended daily intake of calcium increases as we get older. So
Mm-hmm.
for women over the age of 50 and men over the age of 70, the recommended daily intake of calcium is 1,300 milligrams. For younger people, it's 1,000 milligrams. But the average Australian daily intake is about 750 milligrams. So most people are not getting enough calcium. And
Mm-hmm.
once you are a postmenopausal woman or a man over the age of 70, you are super unlikely, probably going to be 500 to 600 milligrams short of calcium
Yeah.
in your everyday diet. So, what would 1,000 milligrams of calcium look like, Moz? What would you have to be eating to get that sort of
So
level?
I often I have seen the show notes and often I think about it in terms of serves of calcium, and so you can perhaps let me know whether I'm misguiding my patients. But I often think about at least 4 healthy serves of calcium. So you kind of want 3 full glasses is about so
Milk, yeah.
each full glass of milk is a serve. A pot of yogurt is a serve. You need several slices of, pre-sliced cheese, thinking like sort of 6 or 7 slices of cheese, or maybe a quarter of a kilo, 240, 250 grams of a soft cheese. Those are sorts of a serve of calcium, and you kind of need 4 of those to sort of keep you up to scratch. How'd I do, Dr. Ann?
I think you did pretty well, Dr. Moz. I would agree with just about all of that. The only thing to say is that if you're having a full round of full fat brie or camembert each day will be absolutely delicious, but it's a lot of fats and a lot of calories, isn't it? So that would be our difficulty if we're recommending people get lots of dairy to ensure they make their calcium needs. We need to step back and look at the bigger picture of it's not the only thing that individuals are interested in, and it's also not the only thing that we're interested in. It's an interesting conundrum where what you do for one part of your health sometimes conflicts a little with what you're aiming to do for, say, your heart health.
Yeah, absolutely. And I guess that's a good segue to that there are some harms from over supplementing with calcium, aren't there, Dr. Ann? So we sort of talk about the kidney stones and, lots of tummy problems with bloating and constipation. And I guess one of the things that we'll often hear if you go do a Google search is some cardiologists are very cautious around their calcium supplementation as well, aren't they, Dr. Ann?
We are. I think the truth is that the studies have been a little inconsistent on whether calcium supplementation does adversely impact the heart, but recommendations are that if you can't meet your calcium through diet or very sure that you're not meeting it, then it's okay to take a supplement, but you should take no more than 600 milligrams a day. And that's a
Yeah.
problem because quite a lot of the sort of leading calcium and vitamin D proprietary brands will recommend that you take 2 of their
Hmm.
calcium and vitamin D tablets a day, and that will actually be 1,200 milligrams of calcium. So for my own patients, I recommend that they take one. If they're vitamin D deficient, I'll get them to take a standalone vitamin D plus one of the calcium and vitamin Ds. But it's probably not, our current opinion is based on sort of evidence and sort of compromise between the different specialists is that 600 milligrams is probably okay. More than that, we don't know is okay and we don't want you to do it.
And surprise, surprise, we fall on the same side of the fence. I also encourage people to ditch the combination vitamin Ds and calciums
Mm.
and get separate vitamin Ds because we love a bit of vitamin D, but we have to be cautious with our calcium. Yeah.
Yeah.
Mm.
So we are probably just about ready to move on to vitamin D. It's
Hmm.
hard to talk about vitamin D and calcium separately because they are so related. So what does vitamin D do in the body? Why is it important to bone health, Moss?
So if you pay attention to social media, it does everything and anything. But I think the things that we want to talk about today are the fact that we know that it increases the absorption of calcium from the stomach and the gut. So
Yep.
essentially, even if you're getting the right amount of calcium, but you don't have enough vitamin D, then the problem is that calcium just goes straight through you. And if you haven't got enough vitamin D, you're not going to make full use of that calcium that you're getting from your diet. And as you mentioned, there's a lot of calories in a wheel of camembert or brie. It'd be a shame to be just getting the calories and not getting the calcium.
Yeah, but it's actually quite astounding that apparently, if you're vitamin D replete, you'll absorb up to 3 times more calcium from your gut than if you're vitamin D deficient, which is astounding. Yeah, because as you say,
Very
if you're
impressive.
getting lots of
Very
calcium but
impressive.
not enough vitamin D, you're almost wasting your time. Yeah.
Yeah. Mm-hmm.
So
Which is why
recommended
they
daily.
come as cocktails. Yep.
Yep. So the recommended daily intake of vitamin D, interestingly, is only 400 international units from the age of 50, rising to 600 international units from the age of 70. But fascinatingly, more than 50% of people living in the southern states, such as we are vitamin D deficient. Now, the other really little cute bit about that is that Medicare, of course, some years back removed the rebate for the vast majority of people for vitamin D testing. So you can have your vitamin D level tested if you wish, but most people are going to have to pay for it. So our recommendation is that you have a careful look at your diet and lifestyle. And if you think you're likely to be vitamin D deficient, you're probably right, and just take a supplement. So there was 2 ways of getting vitamin D. I guess we better talk about that more.
Indeed. And just on that topic of the testing, I think obviously a very, firm reminder that this is educational content, isn't designed to be, individual advice, all that sort of jazz. But there aren't very many Australians that wouldn't benefit from vitamin D supplementation. So, if you're thinking about it and you're thinking to yourself, there's a $60 vitamin D test, or I can buy a year's supply of vitamin D for $20, I know what I'd be doing. Yeah. Sorry, your question was before I
Vitamin
got
D,
sidetracked.
we have 2 ways of getting it. What
Oh
are
yes,
they?
vitamin D. Two ways of getting it. So we can get it from the sun, of course, which we as also skin cancer doctors, we have strong, firm opinions on how to get that from the sun, and we'll cover that, I'm sure. And the other way you can get it is through diet. So you can absolutely get vitamin D from some of the foods that you consume.
Yeah, so some oily fish would be the main source. Yeah.
Yeah.
So your salmons and sardines. UV on the skin, so it's UVB on your skin, you will actually synthesize vitamin D, but of course UV also increases the risk of skin cancer, and as skin cancer doctors we are somewhat wary of a recommendation to increase your exposure to the sun. What if someone was hoping to get sufficient vitamin D from sun exposure, what would the safest recommendation be, Mo?
To make sure that they're paying very close attention to what the UV index is. So, you want to make sure that you are getting that sun exposure outside times of high UV index. So high UV index being 3 and above. So you want to make sure that anytime you're outside that the UV index is less than 3. So that's usually going to be first thing in the morning or last thing of an evening before sunset.
Yeah.
And you can get your
You
sunlight
only
then.
need a relatively short exposure to make your vitamin D. It's not the case that if you stay outside for 8 hours that your skin will be busy making vitamin D for that 8 hours. It does it the first 15 minutes or so, and then it stops for the day. It's need enough.
Yeah. So 10 or 15 minutes is really all you need. And it's outside high UV index times. Please don't get to know us professionally by virtue of producing a bunch of skin cancers. Yeah.
That's calcium and vitamin D, which are very closely associated, and many people will benefit from taking a supplement that contains both of them, but not too much calcium. But probably that should be an individual conversation with your doctor. The other diet thing, which is super important, is actually protein intake. And here we're thinking often about the older who sometimes have very poor protein intake in their diet.
Yeah. So the current Australian recommendation is sort of 0.8 grams per kilogram of body weight. But there are some suggestions that a different number might be better for bone health, Dr. Anne.
Yeah, so at least a gram a day, a gram to 1.2 grams per kilogram might be better for bone health. And really it's about maintaining your muscles. And as a slight aside, we need to be clear what that 0.8 grams per kilogram is, because that's 0.8 grams of pure protein. So if you have 100 grams, say, of chicken breast, that's actually only 30 grams of protein. Yeah. And cheese, for instance, 100 grams of hard cheese, I think would be something like 25 grams of protein. Because otherwise people go, well, I'm 60 kilograms. I easily get 60 grams of protein a day. But you easily have 60 grams of meat or cheese or something a day, but that actually doesn't translate. So I think that can be confusing to the layperson.
And I think everyone who's sort of a gym junkie or has sort of looked at their nutrition from a gym perspective will appreciate it is hard to get that much protein in. It probably requires a conscious effort to ensure that you're hitting those sort of macronutrient target kind of thing.
Yeah. As we said, the issue with not getting enough protein, particularly in the older adults, is muscle loss. Fancy pants name is sarcopenia. And sarcopenia increases the risk of minimal trauma fractures in several ways. Yeah. So the first of the ways is if you have less and weaker muscles, then your joints are not so stable and you are literally more likely to fall over. Yeah? The second thing is that if your muscles are puny and you fall over, you're actually more likely to fracture that bone because it's literally got less padding. That muscles actually sort of crouch the bones and make it less likely that you will fracture. But is there any other way that sarcopenia is a problem, Dr. Moz?
Well, when the bones are sort of doing a good job, as you've said, they're sort of quilted around the muscle, and as they sort of contract and relax, they're actually sort of load bearing up and down against the muscle, so which sort of acts as a bit of a stimulus to produce more bone. So they have a protective effect from that way as well, which is quite interesting.
There is. There's also sort of the small print is that we are becoming aware, and that would be we as in the medical community, not Anne in particular, that there is sort of hormonal crosstalk in between the muscles and the bones. And if one of them is deteriorating, unfortunately they tend to drag their friend along with them. So sarcopenia is to be avoided.
Absolutely. So we want to be exercising so that we make sure that we have nice, big, strong muscles, and we want to be getting protein so that our body can do stuff with the exercise that we're doing. Yep.
So we are going to talk specifically about exercise shortly, but just before we move on, there's a couple of other things still to do with nutrition and lifestyle that we'll cover. So body mass index is a really interesting one, because having a body mass index of 20, so being at the lower end of normal range for health, has twice the risk of a minimal trauma fracture than being at the upper end of healthy weight range, which will come as a disappointment to many because there are a fair few number of middle-aged women, I think to be fair more than men, who make a virtue out of trying to stay on the thin side of normal. And I think they have to understand that, well, cosmetically that might be what they want, they may in fact be harming their bones. It says it's a tough pill to swallow, but those are the stats. Twice the risk of minimal trauma fracture with a body mass index of 20 compared to a body mass index of 25.
And I think it's worth remembering that twice the risk, because I don't think we've said that about anything else, and I don't think that there's going to be anything else that's going to double the risk later on in the podcast. So that's a pretty big risk increase.
Again, a high body mass index, when you look at it superficially, it looks like it might be a little bit protective. So body mass index over 35 does appear to be associated with less risk of a minimal trauma fracture. But again, devil's in the detail. When they correct it for bone mineral density, then for any given bone mineral density, if you are obese, you're actually still at higher risk of fracture. Presumably, I'm thinking because you're at higher risk of falls. What do you think, Dr. Moz?
Yeah, it's a tricky one. And I think, like we've sort of said a bit earlier, there's lots of really complex interplay between the hormones as well. But so it's a really challenging one, isn't it? So BMI less than 20, doubling our risk. BMI greater than 35 also increases our risk. So much like for many other medical conditions, we've got to try and keep that Goldilocks healthy range. Yeah. It's really tough.
And the other thing is that yo-yo dieting, so weight going up and down, weight fluctuating, is also a known risk factor for minimal trauma fracture. And it says 5% fluctuation. Now, that's not actually a lot. If you're a 60 kilogram woman, 5% is 3 kilograms. So that's saying if you're if you're normally 60 kilograms, but your weight fluctuates between 57 and 63, that fluctuation just of 3 kilograms either way it is enough to increase your risk of osteoporosis. So weight maintenance, being a healthy weight, not too skinny, and trying to more or less stay the same weight. If all you were looking at was bone health, that would be desirable.
Yeah.
Good luck with that. Yeah.
Good luck indeed. I think if we managed to solve for that problem, we would have a line of people from here to the end of the universe wanting to know what our secret is, but we don't have that secret, do we, Dr. Anne?
We don't, and I do wonder how we're going to go in the decades to come with our Manjaros and Ozempic type drugs. Interesting to see what impact that has long term on bone health.
Yep, definitely. We'll watch this space and we'll see how we go. Yeah, topic for another day for sure.
So the other things that are bad for your bones, what a surprise, are smoking and drinking too much alcohol.
That I'm sure there are jaws on the floor that is contributing negatively to an aspect of health. So smoking, I think, increases the risk of minimal trauma by about 25%, Dr. Anne, is that right?
And too much alcohol, much the same, 28%. So much the same. And too much alcohol would be more than 10 standard drinks a week, or routinely having more than 4 standard drinks on a single occasion, either of those things. So both smoking and drinking increase your risk by about 25 to 28%. But again, we'll come back to being too skinny, doubles your risk. So,
and I think the other thing as well, you've said that, I'll just say it again, just in case people didn't hear it, 10 standard drinks a week. That there are plenty of patients who would happily consume 10 standard drinks a week and not consider that, an excess of alcohol. And we're not here today to pass judgment. We're here to pass information on what may or may not increase your risk. 10 standard drinks, what's that, six standard beers?
Or a bottle and a quarter of wine.
So that's not a lot to get through before increasing your risk of harming your bone health. So perhaps pay attention to that or consider that with your drinking behaviours.
Right.
And
exercise.
Finally,
exercise. There's a fair bit to be said about exercise. And I don't think we're going to meet our 20-minute target for this.
No.
Okay, so there's 2 specific components to the recommended exercise for bone health. We want you to do things which maintain or even increase your bone mass. And we want to do things which improve your balance so that you don't fall. So what sort of exercise should we do to increase or at least maintain our bone mass?
So the catch cry is weight-bearing or load-bearing exercises. So again, I guess my brain is very small. If you think of your spine as a straight up and down unit, you want things that are going to come down and provide pressure from that top end and squash downwards, and that'll hopefully essentially stimulate the bones to sort of go, oh, I'm being used in this way. I need to get stronger in this way, and so they'll hopefully increase their bone mineral density.
So we need some sort of purposeful stomping involved. Unfortunately, walking doesn't cut it. It's not enough impact involved. So you should be doing exercises that involve purposeful impacts, at least 50 of them every day, ideally. But the sort of things that are recommended are stomping, jumping, hopping, dancing, tennis, basketball, these sorts of things. But as well as having a stomping element, we're really looking for you to have a changing direction element, to stimulate the bone, not just to get strong for that particular movement. The bone will tend to get strong for whatever movement it is that you're doing. And if you're only doing the one movement, then it'll be really strong for that.
Yeah. And it's probably worth mentioning some exercises that aren't good in that context, only because I'm a keen cyclist and I think you're a pretty keen cyclist as well. Those things aren't good because they don't have that compression side of things.
No. I think a lot of cyclists sadly have quite low bone mineral density, which we'll talk more about next week. But yes, my endocrinologist is fond of reminding me that cycling might be my favourite type of cardiovascular exercise, but I'm not helping my bones whatsoever and I need to be doing more things. So cycling sadly not any good for bone health. Walking isn't enough of an impact to make any difference, and swimming also is not weight-bearing exercise and certainly would not be recommended therapeutically with the aim of increasing your bone health.
So it's great if you do those things, but we probably need to add some more load-bearing exercise to maintain bone health.
So we've got our weight-bearing, stomping, moving around in different directions exercise lots of repeats. But we also want you to do some resistance or strength training, which should be moderate to high intensity, and should involve moving the muscle groups that attach to the hip and the spine.
Yeah.
That's at least twice a week, I think, is a current recommendation.
Yeah, I think so. Yep, that's right.
So the other type of exercise that we'd love you to be doing is to do an exercise that increase your balance, that challenge your balance, because the better balanced you are, the less likely you are to fall.
Yeah, absolutely. And I think, again, social media is flooded with, quote unquote mobility exercises and so on and so forth. They're great. Like that's the plan. We want to make sure that we are mobile and agile and have excellent balance so that we're not, on our backsides when we're, trying to tie our shoelaces or do something else like that.
Yep. But it has to be high challenge, and high challenge is very individual, but it's got to be challenging for you. So if you're going to Tai Chi or Pilates or body balance and you're finding that stuff has now become easy for you, then you're not helping yourself. You need to step it up to the next level and make it harder. So you should wobble. You should almost fall over when you're doing your balance stuff, because if it's completely easy within your easy zone, you're not challenging yourself and you're not maintaining or improving.
No, that's right. Yep.
It needs to be challenged basically all levels of our exercise to help our bones.
Excellent. Anything else to add to today's bone health chat, Dr. Anne?
No, I think we've covered all of the things, diet, exercise and lifestyle, but the devil was in the detail, and hopefully we've covered that today. Any people have any questions, we're happy to hear from you.
Indeed. And if you're still listening, thank you so much for your attention. We really, really do appreciate it. Do give the podcast a 5-star rating on Apple Podcasts, Spotify, find the YouTube videos and give it a like and a subscribe. Give us a follow on the social media channels, the Facebook and the Instagram. And I think the most valuable thing really in 2025, we're going to push for people to pretty please share episodes of the podcast. So if you've found an episode really helpful, or if you thought that something was really interesting in one of the podcasts, please share it with someone that you know or love. That's probably the most valuable way that we can help increase the benefit that we provide to the community from the podcast. With that being said, thank you very much for your time, Dr. Anne. Appreciate it as always.
And thanks for yours, Dr. Moz. See you next time. Bye.
Ciao.